Hey, what's up guys? Welcome back to my channel. In this video tutorial, we will know the history and the background of Humana Insurance Organization, its mission and its values. We will also know the basics of Medicare, like what is Medicare, what is the eligibility criteria for Medicare, how to sign up for Medicare, what all it covers and how much it costs, right? So we will understand this step by step, one by one. So without taking much time, let's jump on the official website of Humana Insurance Organization. So we are on the official website of Humana Insurance Organization. But before we start exploring the website, first we will understand the history and background of Humana. Now, Humana was founded in the year 1961 by David Jones Sr. and Wendell Cherry in Louisville, Kentucky, originally as a nursing home company called Extendicare. In 1972, the company rebranded as Humana and began focusing on health insurance and healthcare services. Throughout the 1970s and 1980s, Humana expanded its operations, acquiring hospitals, clinics, and health insurance companies across the United States. The company diversified its offering to include a wide range of healthcare services, including hospital management, physician practices, and pharmacy services. Now, Humana was an early adopter of managed care principles, offering health maintenance organization plans, which is also called as HMO plans, that emphasized preventive care and cost-effective healthcare delivery. In the 1990s, Humana continued to innovate, introducing Medicare Advantage plans and expanding its presence in the Medicare market. Like many healthcare companies, Humana faced challenges in the late 1990s and early 2000s, including regulatory changes and financial pressure. The company underwent significant restructuring, divesting some of its non-core businesses and refocusing on its core health insurance offerings. In the 21st century, Humana experienced renewed growth and success, becoming one of the largest health insurance companies in the United States. The company continued to expand its Medicare Advantage and commercial health insurance businesses while also investing in technology and innovation to improve the customer experiences. In recent years, Humana has focused on partnerships and collaboration to enhance its offering and reach new customers. The company has also been active in advocating of healthcare policy changes and initiative aims at improving access to care and addressing healthcare disparities. Today's Humana is a leading healthcare insurance provider serving millions of members across the United States with a focus on innovation, customer service, and community engagement. Humana continues to play a significant role in the healthcare industry. Now, Humana Insurance Organization's mission and values guides its operation and define its commitment to its members, employees, and communities. Humana's mission is to help people achieve lifelong well-being. This encompasses physical health, emotional well-being, and financial security. They strive to make healthcare more accessible, affordable, and personalized with a focus on preventive care and holistic health management. Now, Humana is committed to putting people first in everything they do. They prioritize the needs and well-being of their members, employees, and communities. Humana embraces innovation to drive positive change in healthcare. They continuously seek new ways to improve health outcomes, enhance customer experience, and make healthcare more efficient and effective. Humana operates with integrity and transparency, adhering to the highest ethical standards to all aspects of their businesses. They build trust through honesty, accountability, and respect for others. Humana values diversity and inclusion, recognizing the unique perspective and contribution to every individual. They strive to create a culture where everyone feels valued, respected, and empowered to success. Humana believes in the power of collaboration to achieve shared goals. They work closely with partners, providers, and community organizations to address complex healthcare challenges and improve health outcomes for all. Humana is committed to continuous learning and improvement. They actively seek feedback, evaluate outcomes, and adapt their approach to ensure they are delivering the highest quality care and services to their members. By upholding their values and staying true to their missions, Humana strive to make a positive impact on the health and well-being of individuals and communities across the United States. Humana offers a variety of insurance plans designed to meet the diverse needs of individuals, families, and seniors. Now, guys, let's explore the Humana official website and let's understand the basics of Medicare. We will start with what is Medicare, all right? So let's understand first what is Medicare, all right? So I have clicked on what is Medicare option, and this is what I've got. What is Medicare and how does it work? Okay, now Medicare is our country's federal health insurance program for people aged 65 and older, as well as some younger people with disabilities or any age with end stage renal disease, which is also called as ESRD. Now, here is a closer look at some Medicare basics, including the parts of Medicare, eligibility, enrollment, and more. If you see here, there are two options. What are parts of Medicare? What are Medicare supplements plan? Okay, and after that, how does Medicare works? Okay, now are you eligible for Medicare? How to enroll in Medicare? Medicare versus Medicaid. All right, so we will understand these options one by one. Okay, now here, what are the parts of Medicare? That's the first question. There are four different parts of Medicare that help cover specific services, guys. The first part is Medicare Part A, hospital insurance. Okay, let's understand Medicare Part A first. Now, Medicare Part A is also known as hospital insurance. This part of original Medicare typically helps cover inpatient services such as hospital stays and care at skilled nursing facility, which is called as SNF. Remember that, okay? Sometimes I will use this short form, okay? So you should know I'm talking about skilled nursing facility, all right? So what does Medicare Part A cover? Now, Medicare Part A generally helps cover many services that you receive in a hospital or long-term care setting. Here are few examples of inpatient care covered by Medicare Part A. Inpatient hospital care. If a doctor formally admits you to a hospital, Part A will cover you for up to 90 days in your benefit period. This period begins the day you are admitted
and ends when you have been out of the hospital for 60 days in a row, guys. Now, once you meet your deductible, Part A will pay for days 1 to 60 that you are in the hospital. For the days 61 and 90s, you will pay a co-insurance for each day. If you need to stay in the hospital for longer than 90 days, you can use up to 60 lifetime reserve days. These are extra days for Medicare coverage for long hospital stays, guys. However, lifetime reserve days are non-renewable and require a daily co-insurance payment. Now, skilled nursing facility care. Part A will help cover many services in a skilled nursing facility, which is called as SNF. This includes room and board as well as administering medicine and changing sterile dressings. Medicare will cover you for up to 100 days in each benefit period. To qualify for this coverage, you must spend at least 3 days as an inpatient in a hospital within 30 days of being admitted to an SNF, guys. Now, hospice care. Now, hospice care can provide comfort when a patient is terminally ill. Unfortunately, there are relatively fewer restrictions on Medicare eligibility for hospice care coverage. As long as your provider certifies the care, Medicare will cover the cost. Home health care, guys, let's understand that. If you need skilled care and are homebound, you could qualify for Medicare coverage for home health care. Skilled care generally refer to services that require a license or medical supervision to carry out. Medicare Part A can cover up to 100 days of home health care if you spend 3 days or more as a hospital inpatient within 14 days of getting home health care, guys. Now, how much does original Medicare Part A cost? Now, original Medicare Part A helps you cover many expenses for hospitals or nursing care, but there are a few costs associated with Part A. Number one, premium free Medicare Part A. Generally, if you are 65 or older and you or your spouse worked and paid Medicare taxes for at least 10 years, you will pay no premium for Medicare Part A. Now, Medicare Part A premium. Now, if you don't qualify for premium free Part A, you can still get original Medicare Part A, but you will have a monthly premium. Your premium will be no more than $505 each month in 2024. Now, this amount depends on how long you or your spouse worked and paid Medicare taxes. Now, Medicare Part A benefit periods, deductibles, and co-pays. There are other costs for Medicare outside of premium, guys. Your deductible is the amount you must pay for healthcare before Medicare begins coverage. For Part A inpatient hospital coverage in 2024, this deductible amount is $1,632 for each benefit period. The Medicare Part A benefit period for a stay in the hospital or an SNF begins the day you are admitted and ends when you have been out of the hospital or SNF for 60 days in a row. You will pay a new deductible with each new benefit period, guys. Now, Medicare Part A copays change based on the benefit period. Co-insurance payment for a Part A during a hospital or SNF stay are: number one, 1 to 60 days, $0 copay for each benefit period; 61 days to 90 days, $408 copay per day in each benefit period. Now 91 days and after, $816 copay per each lifetime reserve day, guys. Okay. Now, am I eligible for Medicare Part A? Okay. Now, most people become eligible for Medicare Part A and Part B, also called original Medicare, when they turn 65. However, you may be eligible for Medicare before you turn 65 under certain conditions. Number one, if you have been getting Social Security disability benefits for 24 months in a row. If you have amyotrophic lateral sclerosis, also known as Loy-Crick disease. If you have end-stage kidney disease, which is also called as ESKD, and need regular dialysis or a transplant. Okay. Now, how to enroll in Medicare Part A? Now, if you are eligible to enroll in Medicare, you can sign up for Part A and Part B through the Social Security website. You can sign up for Medicare in the following enrollment period: initial enrollment period, which is also called as IEP. Now, this period starts 3 months before you turn 65 and ends 3 months after your 65th birthday, guys. Generally, enrollment period, which is called as GEP, this runs from Jan 1st to March 31st each year. If you miss your EIP, you may have to pay a monthly late enrollment penalty, guys. Now, special enrollment period, which is called as SEP. In some cases, you can sign up for Medicare outside of your IEP without paying a late enrollment penalty. For example, if you are still working past 65 and get health insurance through your job, you might qualify for an SEP, guide. Now, what other coverage works with Medicare Part A? Now, Medicare may not cover everything you need, but there are other ways you can help pay for some medical cost. One option is Medicare Supplement Insurance, also called Medigap. Although Medigap can't cover long-term care, it can help cover costs such as co-payments, deductibles, or co-insurance. Now, Medicare is not the same as Medicare Advantage and can only be combined with original Medicare, guys. Now, Medicare Advantage and is another option. Medicare Advantage plans are offered through private companies and offer coverage for everything, including original Medicare Part A and Part B. Many Medicare Advantage plans may also include coverage for services outside of original Medicare, including vision, dental, or Part D prescription drug coverage. All right. Now, these were the basics when we spoke about what is Medicare and different parts. All right. Now, let's go back. All right. Let's hold on for a while. Okay. Super. Okay. So we have now got to know Medicare Part A, hospital insurance. Now let's understand Medicare Part B, medical insurance. Let's click on this option. All right, what is Medicare Part B? Okay, what does original Medicare Part B covers? While original Medicare Part A, with its coverage for hospital visits and skilled nursing care, can help you manage the big stuff. That's only part of the picture. Original Medicare Part B helps you get the care you need for a lot of the other stuffs that requires a doctor's care. And you can receive care from any doctor who accepts Medicare patients. Now, original Medicare Part B helps. Now, original Medicare Part B helps cover medically necessary doctor services, outpatient care, even if you receive that care in a hospital, chiropractic care if medically necessary, home health services, mental health services, ambulance services, durable medical equipment, which may include crutches, walkers, hospital beds, ventilators, and other equipment you may need outside of a hospital, guys. Now, original Medicare Part B also helps cover a number of preventive services if you qualify by age, gender, or risk factors. This may include like annual wellness visits, flu, COVID-19, hepatitis B, and pneumonia vaccines, diabetes screening, depression screening, mammograms, colorectal cancer screening, bone mass measurements, pap test, and pelvic exams, guys. All right. Now, what services are not covered by Medicare Part B? If you or your doctor aren't sure if a particular test Now, if you or your doctor aren't sure if a particular test, item, or service is covered, Medicare offers a helpful site where you can verify your coverage. Okay. How much does Medicare Part B cost? Now, let's understand that. Now, Medicare Part B premium. Generally, most 2024 Medicare members must pay a monthly Part B premium of $174.70. Your Part B premium could be higher depending on your income. If your modified adjusted gross income from 2 years ago is above a certain amount, you will pay the standard premium plus what's called an income related monthly adjustment amount, IRMAA. To see if this applies to you, look at your past income tax return. You will find your modified adjusted gross income there, guys. Now, for most people, paying the premium is simple. Your Part B premium will be automatically deducted from your benefit payments if you get benefit from one of these: Social Security, Railroad Retirement Board, Office of Personal Management. Okay, now Medicare Part B deductibles. Like most insurance plans, Medicare Part B does have a standard deductible. In 2024, that deductible is $240. After you meet your deductible for the year, you will typically pay 20% of the Medicare approved amount for most Part B covered services. Now, Medicare Part B co-insurance. After the deductible, you pay a co-insurance of 20% that will apply to most doctor services, including most doctor services while you are a hospital inpatient, outpatient therapy, durable medical equipment, which is called as DME, doctor visits to diagnose a mental health condition. Worried about Medicare cost? Each state offers Medicare saving program to Medicare beneficiaries who Each state offers Medicare saving programs to Medicare beneficiaries whose income falls below a certain level. Most states also consider your assets when determining eligibility. If you qualify, these state-sponsored programs will help pay your monthly Part A or Part B Medicare premium, guys. These programs will not change your health plan benefits or coverage. They are provided by your states at no cost for you. Now, am I eligible for Medicare Part B? Most people become eligible for Medicare when they turn 65. Some people may qualify before age 65 due to illness or disability. If you are ready to explore your Medicare options, you can visit medicare.gov. If verify your eligibility to verify your eligibility, guys, my bad, it's quick and easy. When can I enroll in Medicare Part B? Now, waiting for your 65th birthday to sign up? Good news, you have time to shop. Your initial enrollment period begins 3 months before the month of your 65th birthday, includes your birthday month, and continues through the 3 months after the month of your 65th birthday. That gives you 7 months to learn about Medicare and compare plans so you can make the right choice for you. Already have a Medicare plan? It's good to remember that choosing a Medicare plan is not a lifetime commitment. Generally, you can join, switch, or drop a Medicare Advantage Part C plan during this time. Open enrollment period. From October 15th to December 7th each year, you can join, switch, or drop a plan. Your coverage will begin on January 1st as long as the plan gets your request by December 7th. Medicare Advantage open enrollment period. Now, what is that? From January 1st till March 31st each year, if you are enrolled in a Medicare Advantage plan, you can switch to a different Medicare Advantage plan or switch to original Medicare. Special enrollment period. Now, you can make changes to your Medicare Advantage and Medicare prescription drug coverage when certain events happen in your life, like if you have moved or you lose other insurance coverage. Avoid a Medicare Part B late enrollment penalty. If you don't enroll in Medicare Part B as soon as you are eligible and you don't have other credible coverage, you could be assessed a late enrollment penalty when you do enroll. The penalty could be as high as 10% increase in your premium for each 12 months period that you were eligible but not enrolled. You can delay enrolling a Medicare Part B with no penalty if you are working or already covered by your employer's private health insurance. After your employment health coverage ends, you have 8 months to sign up for Part B without a late penalty. Are there any alternatives to Medicare Part B? You can opt for a Medicare Advantage Medicare Part C plan. These plans are offered by private insurer like Humana. They are required by law to offer all the benefit of original Medicare Part A and Part B, and most also may include coverage for things like prescription drugs and dental, vision, and hearing coverage. All right. Now, this was the complete understanding about the Medicare. So now we know Medicare Part B. All right. Let's go back and understand the another option, which is Medicare Part C, which is called as Medicare Advantage. All right. So let's click here and understand in detail about Medicare Part C. Now, what is Medicare Part C? Medicare Advantage Plan. Medicare Advantage, MA, also called Medicare Part C, are private insurance plans offered by Medicare approved companies. Medicare Advantage plans provide most of Part A hospital insurance and Part B medical insurance coverage and typically offer extra benefits such as vision, hearing, and dental care. Some Part C plan also include Medicare Part D prescription drug coverage, which is also called as MAPD plans. Okay, now what does Medicare Advantage cover? Original Medicare versus Medicare Advantage, types of Medicare Advantage plans, frequently asked question. Okay, now well, let's understand this. Okay, now what does Medicare Advantage cover? Now Medicare Advantage plan cover all the inpatient and outpatient services that Medicare Part A and Part B covers, except clinical trials and hospice services. All right, now if you enroll a Medicare Advantage plan, original Medicare will still help cover the cost for hospice care, some new Medicare benefits, and some cost for clinical research studies, guys. Now, some of the medically necessary services covered by Medicare Advantage plan and original Medicare include primary care and specialist doctor visits, laboratory tests, X-rays, emergency ambulatory services, durable medical equipment, preventive tests, and vaccines, physical therapy, guys. Now, Medicare Advantage plan can also include prescription drug coverage. To get the same coverage with original Medicare, you would have you have buy to you would have to buy a separate prescription drug plan and pay a separate premium, guys. Okay, now extra benefits include with a Medicare Advantage plans. Let's understand that. Since MA plans are offered by private companies, they can be customized with extra benefits. Some benefits may provide coverage for routine dental care, dental exams, x-ray, teeth cleanings, okay, routine vision care, eye exam, eyeglass, uh, routine vision care like eye exams, eyeglasses, and contacts, routine hearing care like hearing tests, hearing aids, fitness programs, gym membership, transportation to doctor visits, okay, over-the-counter drugs. MA plan can also be customized to treat specific conditions and diseases. Now, what's the difference between Medicare Advantage and original Medicare? Let's understand the difference. The main difference is Medicare Advantage plans are offered by private companies and original Medicare is administered by the federal government. Okay. To learn more about the difference, check out these helpful side-by-side comparison of the to learn more about the difference, check out this helpful side-by-side comparison of original Medicare and Medicare Advantage. Okay. Now, types of Medicare Advantage plans. Here is a quick look at some common Medicare Advantage plans, guys. Now, this is the differences. Health Maintenance Organizations, which is called as HMO. HMO may offer lower premium than other plans. You must usually stay within your plan's networks for care and services. Okay, now second is Preferred Provider Organization Plan, that is PPO. Now, PPO may allow you to go out of network for care. You will usually pay less if you stay within the plan's network. Now, private fee for services, which is also called as PFFS. Okay, now a PFFS plan may or not be network based and requires non-network providers to accept Medicare reimbursement and the plan's terms. Now, special needs plans, which is called as SNP. Now, SNP are designed for people with chronic conditions such as diabetes and individuals who qualify for both Medicare and Medicaid, guys. Medical saving account, which is called as MSA. Okay, now MSAs combines a high deductible plan with a designated saving account. These plans do not include prescription drug coverage. Okay, now HMO point of service, which is also called as HMO-POS. This hybrid HMO lets you go outside the network for treatment but may have a high cost. Okay, there can be separate deductibles for in-network and out-of-network cost, guys. Now, these are frequently asked questions like how much do Medicare Advantage plan cost? The cost of Medicare Advantage plans depends on the plan and the company. The projected average minimum premium, the projected average premium for a Medicare Advantage plan in 2024 is $18.50 per month. But there are other costs to consider, such as copays and deductibles. Now, how do I enroll in a Medicare Advantage plan? No, these are the questions few people must have. Your first choice to sign up for Medicare Advantage is during your Medicare initial enrollment period. IEP. The IEP for Medicare starts 3 months before the month you turn 65 and ends 3 months after. If you have original Medicare and want to enroll in Medicare Advantage for the first time, you can choose a Medicare Advantage plan during Medicare Annual Enrollment Period, AEP. Medicare's AEP runs from October 15th to December 7th. Okay, if you are already enrolled in a Medicare Advantage, you can switch plans during the Medicare Advantage Open Enrollment Period, which is called as OEP. The Medicare Advantage OEP runs from January 1st to March 31st, or annual enrollment period of Medicare. Now, do I need a Medicare Advantage plan? That is the question. Everyone has different health needs. If you have a chronic condition or need routine medical care, the comprehensive coverage of a Medicare Advantage could make sense. Set aside time to research MA plans that fits your needs. Make a list and choose the one that benefits you the most. All right. Now, I'm sure that whatever we have discussed here, you have understood everything about Medicare Part C now. All right. So we have spoken in. Now let's understand Medicare Part D, which is called as prescription drug coverage. All right. Now, what is Medicare Part D prescription drug coverage? Okay, Medicare Part D helps cover. Now, what is Medicare Part D prescription drugs coverage? All right, let's understand that. Now, Medicare Part D helps cover the cost of prescription drugs. Part D is optional and only provided through private insurance companies approved by the federal government. However, Part D is offered to everyone who qualifies for Medicare, guys. Costs and coverage may vary from plan to plan. Read on to the learn more about Medicare Part D prescription drug coverage, how to get it and what it covers. Okay, let's understand how to get prescription drug coverage. Now, there are two ways to get Medicare Part D prescription drug coverage. Number one, as a standalone prescription drug plan with Medicare, if you have Medicare Part A and Part B, also called as original Medicare, as we discussed earlier, you can add a Part D prescription drug plan to your existing coverage, guys. Okay, now this is first. Now, second, as part of a Medicare Advantage plan, Medicare Part C, Medicare Advantage plans includes all your Part A and Part B coverage. They may also include prescription drug insurance. Not all Medicare Advantage plan include prescription drug coverage, and you must already have Part A and Part B to qualify for Medicare Advantage, guys. All right. Now, what does Medicare Part D cover? Let's understand that. Each Medicare Part D plan uses a list of approved drugs to decide what's covered and what isn't. This list is called a drug formulary. Now, the formulary may differ from plan to plan. Many plans arrange their list of covered drugs in different levels called tiers. Generally, drugs in a lower tier will cost less than drugs in the higher tier. Here is one example of a typical Medicare drug plan's tier system. But remember, your plan may be different. Okay, now tier 1, preferred generic. Generic or brand drugs that are available at the lowest cost shared for the plan. Now, tier 2, generic. Generic or brand drugs that the plan offers at a higher cost to you than tier 1 preferred generic drugs. Now, tier 3, preferred brand. Generic or brand drugs that the plan offers at the lowest cost to you than tier 4 non-preferred drugs. Okay. Now, tier 4, non-preferred drugs. Generic brand drugs that the plan offers at the higher cost to you than tier 3 preferred brand drugs. Now, tier 5, specialty tier, some injectable and other high-cost drugs. Tier 6, select care drugs, select generic and brand drugs used to treat certain chronic conditions. Okay, now what drugs are not covered by Part D? Some medications may not be covered by your Medicare Part D plan, guys. This could depend on your plan's formulary, which may limit coverage of some drugs based on medical necessity, cost, or safety. Now, Medicare Part D restriction and limitation. Let's understand that. Some prescription drug plans may have restrictions on certain medications. This can include prior authorization. Your doctor may need approval from your plan before prescribing some medications. These may be because a drug is only approved for certain conditions or to ensure that the drug is medically necessary. Step therapy. For some conditions, your plan may require you to try a cheaper drugs on your formulary first. If the cheaper medication doesn't work for your conditions or produce bad side effect, you may be able to move up steps to a more expensive drug, guys. Now, quantity limits. Sometimes plan may limit the amount of medication prescribed over a period of time. This is done for safety reasons or to cut down on cost, guys. What to do if your drug isn't covered? If you have trouble getting the medication that you want covered, you may be able to appeal. You and your doctor can submit a formal request for an exception to a drug coverage rule. For example, you could send a request to get coverage for a drug that's not in your formulary. You could also send a request to waive a step therapy requirement to use a lower tier drug, guys. Now, how much does Medicare Part D cost? The cost for Medicare Part D consists of several different payments. The exact amount of this cost may vary depending on your plan, guys, what tier a drug is in, or what pharmacy you use. Monthly premiums. For most prescription drug plans, you will pay a premium or a monthly fee. The premium is paid in addition to the one you pay for Medicare Part B. Now, monthly adjustments. If you if your income is above a certain limit, you may pay a monthly adjustment payment in addition to your prescription drug premium. See the chart on the Medicare website for an explanation of Part D monthly cost by income, guys. Yearly deductible. For many plans, you may have to pay a certain amount each year for your prescription drugs before the Medicare drug plan kicks in to cover cost. The amount is called the yearly deductible. For 2024, no Medicare drug plan may have a deductible higher than $545. Co-payments or co-insurance. After you meet your deductible, your plan may require you to pay for part of the cost of your prescription. This amount is called the co-payment or co-insurance. In 2024, once you and your insurance spend a combined total of $5,030, including any applicable deductible, you will pay no more than 25% of the cost of prescriptions. This 25% cap will continue until your out-of-pocket spending hits $8,000. Understanding the coverage gap, guys. For most Medicare prescription plan, there is a temporary limit on what the plan covers. This is called the coverage gap, also known as the donut hole. In 2024, this coverage gap will be triggered once you and your plan spend a combined $5,030 on covered medications. Once you are in the coverage gap, you will pay no more than 25% of the cost for covered Part D drugs in your plan, guys. Now, catastrophic coverage. Starting January 1st, 2024, once your out-of-pocket spending reaches $8,000 plus dollars, including certain payments made by other people on entities, including Medicare's Extra Help program, on your behalf. You will move to the catastrophic coverage stage. This means you won't have to pay a co-payment or co-insurance for covered Part D drugs for the rest of the calendar year. Now, how to get extra help? Depending on your income, you may qualify for extra help. Extra help is a program that assists with those with limited resources in paying for their Medicare prescription drug cost. You may automatically qualify for extra help if you have Medicare and are enrolled in any of the following programs: a full Medicaid coverage, assistance from your state Medicaid program, for covering Part B premium, supplement security income benefit, supplemental security income benefit. Even if you don't automatically qualify, you can apply for extra help anytime. Even if you don't automatically qualify, you can apply for extra help anytime. Okay, now how to enroll in Medicare Part D. Okay, typically, if you qualify for Medicare, you qualify for Part D prescription drug coverage. But it's important to keep in mind that you may enroll in Part D coverage only in few specific periods. Your Medicare Initial Enrollment Period, IEP, that is the short form, you can enroll in a Part D plan in the 3 months you turn 65, the month of your 65th birthday, or third month after, 3 months after, my bad. Now, the Medicare Annual Enrollment Period, which is called as AEP, this runs from October 15 to December 7 every year. During the AEP, you may make changes to your Medicare Part C and Part D coverage. They will take effect on January 1 of the following year. The Medicare Advantage Open Enrollment Period, which is called as OEP, these last from January 1st to March 31st each year. You may add, drop, or change your Part D coverage during this time, guys. Now, Special Enrollment Period, which is called as SEP, you may be able to enroll in a new part. You may be Special Enrollment Period, which is called as SEP, you may be able to enroll in a new Part D plan if you are eligible for an SEP. You may qualify for an SEP under certain circumstances, such as if you make changes to a job-based drug coverage plan, or if you have or lose extra help. Now, these are the frequently asked questions, guys. Let's go through it. What is the Part D late enrollment penalty? The Part D late enrollment penalty is an amount that's permanently added to your Part D premium if for 63 days in a row you don't have Medicare drug coverage or other creditable drug coverage. Creditable drug coverage refers to a drug plan that pays at least as much as Medicare Part D on average. To avoid paying the late enrollment penalty, it's important to enroll in Medicare Part D or have other credit creditable drug coverage during your IEP. Make sure to enroll in Part D if you lose your creditable drug coverage. If you keep your creditable drug coverage, it's a good idea to keep records providing that you are enrolled. Now, how does Medicare Part D work with other insurance? If you already have prescription drug coverage through other plan, there will usually be some coordination of benefits between Medicare and your current drug coverage provider. Depending on your current coverage, Medicare will be either your primary or a secondary payer for prescription drug coverage. Okay, see Medicare explanation on how Part D interact with other plans to see coverage options that may apply to you. Okay, now how to find the right Medicare Part D plan. There are many Medicare Part D plans to choose from, so it is important to find the one that works best for you. Be sure to check the plan formulary or list of approved drugs as well as the pharmacy network. Medicare.gov has a simple tool to compare Part D plans, guys. Now, many Medicare Advantage plans includes Part D prescription drug coverage. Check out Humana's Medicare Advantage plans to see if you may be eligible to enroll and find coverage that meets your needs, guys. So now let me guide you on how to sign in on Humana official website, guys. The first thing which you have to do, you have to go to your browser and type www.humana.com in your search bar, or else you can go on your Google search engine and you can type Humana Insurance. You will get many options. Out of those options, you have to select the official website of Humana and click on that website and open that website. Now, once you are on Humana page, this is how the Humana official website looks like. Now, at the right hand side at the top, you will see sign in option. This is the option. Now you have to click on this option, right? Now, once you click on this option, new page will open. Now look at this. Now here you have to fill all your details, guys. You have to fill your personal details here. This includes your username, password, right? And then you have to sign in. Then you have to click on sign in, guys, right? This is how you create your username and password. If you forgot your password and username, you can see these options: forgot username and forgot password, right? Now, before finalizing your registration, you may be asked to review and agree to the terms and conditions of privacy policy of Humana Insurance. Make sure to read these documents carefully and proceed accordingly. Once you have filled in all the required information and agreed to the terms, look for the button on the link to submit your registration. Click on it to complete the registration process. Okay. After successfully submitting your registration, you may receive a confirmation message or email from Humana Insurance. Follow any instruction provided to activate your account, which may involve clicking on a verification link sent to your email. Once your account is activated, you can log into Humana website using the username and password you created during registration. From there, you can access your insurance information, benefits, claims, and other features available to members, guys. Right? If you have if you encounter any difficulties during the registration process, you can usually find help resource such as frequently asked questions, chat support, or customer service. Contact information on the Humana website to assist you. Well, thanks for joining me in exploring Humana Insurance today. Right? We have covered a lot of topics today. We know Humana as an organization, its history, background, mission, and vision. We know the basics. We have learned about Medicare, basics of Medicare, like what is Medicare, the eligibility criteria for Medicare, to sign up, how to sign up for Medicare, how much does Medicare cost, what does Medicare cover, and many more. All right. Remember, your health matters, and having the right coverage is key. With Humana, you are not just getting insurance, you are gaining a partner in your health journey, guys. Stay informed, stay proactive, and consider Humana for peace of mind.
Alright guys, so that's all for this video, and in our next video we will be talking about some different topics of Humana Insurance Company. I will be making such informative and knowledgeable videos for you, but don't forget to hit that subscribe button, smash the like, and click that notification bell for all the updates. All right, so that's all about it. See you in my next video. Till then, bye.